Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Today, we have an interview in action from the 2024 conferences, the spring conferences, ViVE in LA, HIMSS in Orlando. Special thanks to our sponsors, Quantum Health, Gordian, Dr. First, CDW, Gozio Health, Artisight, and Zscaler. You can check them out on our website, thisweekhealth.com. Now, on to our interview.
We are at ViVE 2024, and I'm here with my good friend, Jeff Sturman from Memorial. And he has all the answers to all the questions that we're going to ask.
I have no answers, but I'll pretend.
All right, perfect. First question is, there's a lot of stuff going on. You came here with something in mind. You were working on stuff. What's going on back home? What's up?
I always come to this thinking that you're going to get some novel idea, but there's two things. I always love the network. I love meeting people. I love talking to people. I love hearing what they're doing because I just think we're better together. And so it's important that we learn from each other and take those stories back to our own healthcare system so that we can all get more innovative, more evolved, and absolutely the network is important. The second thing is we're all focused in healthcare on experience. We're all focused today to make healthcare just a little bit easier. And I say it all the time. If I can just hit imprint on healthcare just a little bit to make the process, the workflows, the technology to support what we all do, just make the work a little bit easier for consumers to navigate, and I think that's a win. So I'm looking for those solutions that can really be innovative and maybe even think differently, because we don't think differently a lot. We think about the same. And we're still stuck in a lot of our electronic health records and ERP solutions, and maybe those can actually influence the way we deliver care, and I think they can, but there's got to be some things that we can do a little bit differently to move the needle.
Leave it better than you found it, one of those things. So you're here, you come with all of that in mind. You've been around the floor now for a day. You just came off panel. How did the panel go?
It was great.
Awesome.
Yeah.
What was the topic?
Clear. Like in the airport, everyone uses Clear. So Memorial's an early adopter. We are starting the process by which we leverage Clear for MyChart password resets, MyChart activation, and check-in. And I think facial recognition, get away from those palm scanners and other devices.
And from a security perspective, as a security guy at 229, feels like that's a good match too. Anything else you picked up on the floor that you're like, that's really cool and interesting? You don't have to say the product name or whatever, but like things that you were like, I'm totally taking this home and looking at it later.
Well, not only am I taking it home, but it's reinforcing things that we're already starting. Some things around touchless monitoring, some things around virtual nursing. We're putting a command center in place, for example, right now. And I know a lot of places have done that. We might be a little late to the party. We might be right in the middle of the party. Sure. Not sure. But certainly that critical command center of really navigating a complex healthcare system, patient flow, some of these technologies that we've been looking at for a long time, that's really cementing in my mind how they can work is really valuable here.
Yeah, awesome. Okay, I have one more question. It's the interesting one. A fictional character, any fictional character that you could have as a life coach, who would that be and why?
So I'm a big fan of The Godfather. And so I'm going to go Michael Corleone. Keep your friends close, keep your enemies closer. And I think there's a lot to be said about learning from the great organization he put together.
A great organization.
Yeah, it might be a little corrupt, but come on, I mean, you got to give that guy credit. He took care of the way things.
Yeah, for sure. Okay, that has to be one of the most classic answers so far. Thanks for your time. I really appreciate
Thank
it.
you, brother.
Yeah.
Here we are from ViVE 2024 in LA, and I'm joined by Joshua Titus, CEO for Gozio Health. I'm looking forward to the conversation.
They're looking forward to it as well.
A lot of discussion about the patient experience and engaging patients. I'm not sure if we're using consumer. Is consumer the right word, or is patient the right word today?
I would call it religion around it, but what we've learned to speak of it as before they've come in to meet their provider, they are a consumer. They are going to search for the best care. They're going to talk to friends and family. They're in consumer mode. Once they're in those doors and they're in front of a provider or someone who's actually taking care of them in the room, they're a patient, absolutely. The minute they're looking for follow-up care and they're again back to doing that search on Google or wherever, they're a consumer.
But
so there's a transition.
The interesting thing is consumer patient.
Yeah.
Sometimes that's referred to as we want a consumer experience, we want a patient experience. And generally the consumer experience, we think, oh, this is the Amazon experience. It's very easy. But when we get to the patient experience, it gets clunky and gnarled up. And we've struggled with that in healthcare. To like, bring that seamless experience all the way across?
It has been a struggle, but we have some proof out there that can be done. When I think about my experience coming here, I opened up the Delta app and I booked my ticket on it, and it told me that my gate had changed, and I swapped seats, and the whole thing, incredibly complex system behind the scenes, but to me, that interface was fairly seamless and simple. And I think that in healthcare, that's a proof that it can happen. And it's certainly something that we strive towards with Gozio, is to take a relatively complex organization and abstract it down to something that is fairly simple and straightforward, that's in users' hands. Yeah.
In the ever-evolving world of health IT, staying updated isn't just an option, it's essential. Welcome to This Week Health, your daily dose of news, podcasts, and expert commentary designed specifically for healthcare professionals like yourself. Discover the future of health IT news with This Week Health. Our new news aggregation process brings you the most relevant handpicked stories from the world of health IT, curated by experts, summarized for clarity, and delivered directly to you. No more sifting through irrelevant news, just pure focused content to keep you informed and ahead. Don't be left behind. Start your day with insight at the intersection of technology and healthcare. This Week Health, where information inspires innovation.
Talk to me about, because it's interesting with our web traffic. If you go back 2 years, a majority of our web traffic was from a desktop. Today, I would say 75% of our traffic is through the phone.
Through the phone, yes.
That change has happened. Tell us about Gozio and your approach.
Yeah, for better or for worse, these are our problem-solving companions. I saw a study recently where you're more likely to turn around and go home if you forgot your phone than if you forgot your wallet.
Yes.
Yeah, and so we made the switch, for better or for worse. And one thing that, coming from behind in healthcare, the good part about that is that we've learned and people have been taught what to expect through all other aspects of their interface to the real world, whether it's retail, whether it's open table to grab a table, or Google Maps to find your way around. Like, expectations are already set, so we just have to meet those expectations. We're not creating them. So people just want in healthcare the same experience they have everywhere else in terms of how mobile should work. So we really get to cheat off of homework of a decade of experience of everybody else and just bring healthcare up to speed.
Yeah, I'm watching this demo behind us. And some people will be able to see this. This will be a podcast as well.
Oh, cool.
But it's exactly what you think it is. Search for the provider, you put the provider's name in, map shows up, dots on the map.
Let me grab some time on my provider's calendar. I will get turn-by-turn directions to his office when the time comes. I can find some follow-up care when I need to. I can save him as a favorite. I want to look at all the urgent cares near me and know what the wait times are and save my spot so there's no waiting. Just basic stuff that we can do in an open table and, again, other apps, but just bringing that into the healthcare context.
But the directions don't stop at, hey, you got to the office. If you get to that campus, it integrates with Wi-Fi.
We'll remember the exact spot that you parked in, not what it's like to be at one of these big campuses, right? You probably are going to have a procedure done or some test results. You're stressed. And so the fact that you're having to do this in a stressful situation in this really complex campus, to be able to give someone a hand-holding experience to their point of care and back again, it's a key component to making sure that now they're cool patient mode. That patient mode piece is also really smooth.
There are other, to the people who are sitting there going, well, we have MyChart.
Yeah.
This covered. We're good to go.
Yeah.
This is much more than MyChart.
One of our clients actually had to elucidate this for me, and they did a phenomenal job, so I'm just going to repeat what they told me. They said, essentially, the patient portal is an incredibly important part of their website. There's no way it's the whole website. There's so much more that they want to do that's specific to their catchment area or their brand or their system. Key component, absolutely. The entire thing, absolutely not. On the mobile space, MyChart, absolutely. Phenomenal experience, does some things extremely well. It's a part of the solution. It's not the whole thing.
It wraps around MyChart?
We commonly integrate MyChart into our platform so that you can do the things that you want to do around whatever other vendors and data sources that you have. And I can click on it, use face recognition, for instance, and I'm right into MyChart, and I have authenticated experience with all of my lab results and communication from my doctors and that sort of thing. But it's integrated into a single spot, and that's really the key.
Do your clients ever go off and write their own applications that plug in, or do they primarily come to you and say, hey, look, we need a new feature?
So our platform is completely open, and if there was a feature that we didn't have, we will absolutely talk about us doing it for you, you doing it, or bringing a third party to code up that piece. Historically, what's happened is we've just done it for them, but we do have some examples where they've built out specific things for they have a particular need that is really unique to that system, and they want that to be implemented, and we can work with them to implement it. So it's a mix, but the point is we're open, and those things change over time. You think if you have one vendor to begin with, and we see this a lot, that vendor comes into prominence and will be the one that everyone's going to around, let's say, scheduling, and then suddenly you have a new sheriff in town and they come in and people want to swap. You need to be able to do that without having to rewrite your app every time. So how do I do that? Our platform allows you to switch out different vendors basically behind the scenes.
Gives that layer of abstraction.
That's exactly right.
It's interesting because I've talked to some CIOs who are like, hey, I've been asked to create some distinction with our patient experience.
Yeah.
And this is one of the ways to do that. If today you have just that MyChart experience, there's nothing to keep the system across the street, down the road, whatever. It's
starting with the download. I want to search for Yale to download the Yale app, right? I don't want to search for MyChart. Yeah, so yes, you can begin to brand right off the bat with it's their app, essentially.
Interesting. So you white box.
White label, completely, 100%, yeah. So we're in 27 or so systems. Each one of those would be unique to that system. You would download their app.
Well, Joshua, I can't let you get by without talking about AI because it's our duty to use the buzzwords at least once. But I am curious because there's a lot of talk about how chatbots are going to change based on large language models and where we're going. Do you see this being a place where people are going to start and have those conversations and have those discussions with the health system in general?
Absolutely, yeah. We partnered with Hyra. We saw their demo of their chatbot, AI chatbot. It was phenomenal. 24 hours later, we'd already integrated it in and we're co-presenting. So the ability to give this really neat technology that by itself may not stand alone, but integrated into, look, I've got 100,000 users at this one system, let's put you in front of all of them. They were able to integrate into our platform, and the way that it works is you chat with it, tells you what you need to know, where it got that information from, so about here are the 5 sources that we use, and then if you need to head that way, it plugs right into our wayfinding and then off you go. So it's marrying that AI chatbot capability with the rest of the platform.
It's interesting, when I think about health, I don't want to go to Google. I'd really like to go to my local health system or that branded. I want to have a relationship with that local health system. And it's hard. It's not easy. And so I find that I went on a weight loss journey and I found I went over here for one aspect, over here for another, over here for another. This integrates it. It brings it in. I'm curious if you've seen survey data after pre and post use of Gozio.
We didn't even have to do a survey. What we saw is that we'd go into a system that had a mobile app that had a few components, but not quite enough to reach that critical mass. And the one thing that you need to know is we found there's no killer feature. If that feature alone is enough to get me to download and install your mobile app, but it's going to be a combination of features that suddenly you're going to reach a tipping point and the numbers go through the roof. So very common for us to go into a system that has, like, say, 2 users a day, literally, on a mobile application. We add the pieces that they're missing on our platform, and we'll go to 10,000 a day. We're talking orders of magnitude greater user engagement. Because again, there's no killer feature, but we added some wayfinding, we had the ability to schedule some time in your doctor's calendar. We did a plugin of the EHR, or the patient portal.
And you know exactly how this goes, right? Yeah. So I live in Florida.
Okay.
And invariably you talk about golf, you talk about your community that you live in, and then you talk about your health. And how it goes, oh, you wouldn't believe. And then you have these people demoing. It's like, oh my gosh, look, it gives me the map on the health system. I could do this, I could do that.
Exactly.
That's your advertising right there.
That builds that durable relationship with your patient when they're in consumer mode.
Josh, cool. Thank you for your time.
Thank you for your time. Appreciate it. Good talking to you.
Thanks for listening to this Interview in Action episode. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, would be great. And we want to give a big thanks to our partners who make this possible: Quantum Health, Gordian, Dr. First, CDW, Gozio Health, Artisite, and Zscaler. You can learn more about them by visiting thisweekhealth.com/partners. Thanks for listening. That's all for now.